Hello, everybody. This is Dr. Kamel again, and a new content related to the physical therapy license exam preparation. If you didn't see any of my videos or content before, my name is Dr. Kamel. I am working as Associate Professor of Physical Therapy in the United States, and I am a licensed physical therapist in different states across the US and also in the UK. I have got my PhD from University of Nottingham in the UK. So let's go to the question for today and see what the content is about. It is not only about question, it is mainly about that we discuss this clinical related content. So it will be useful even for people who are not planning to take exams, just to be, an informed and updated physical therapist. So let's go to the content. A 72-year-old patient in is status post right total knee arthroplasty. So the patient had replacement of the right knee, okay, which was performed 2 days ago. So is recent, okay, and we know that we have something called Wells criteria, in which if the patient had recently surgery or something like that, and still within 2 days, 3 days, so the patient might be at risk of developing some complications. But if you see a patient who, they tell you that somebody had a right total knee arthroplasty 6 months ago, then this risk factor is not applying here. So timing is very important. The patient has a medical history significant for hypertension. This is another risk factor. Type 2 diabetes mellitus, another risk factor, and peripheral vascular disease. More, so more and more and more cardiovascular risk, as you can see. During the physical therapy examination, the therapist observes a bluish discoloration of the toes on the operative extremity. Okay, so there is a change of color, which might show us that might be a compromised circulatory situation. The toes are cold to touch by palpation. Is very obvious, giving you a lot of information. If you see that the toes are cold to touch, this means that there is no enough blood supply going there, and it looks like somebody might have peripheral vascular disease, obstruction of blood supply. I don't know. Capillary refill is delayed. Oh, this is another test which we do in order to check the peripheral circulation. How should this finding be most appropriately documented? Is it just cyanosis? I don't think this is enough. Deep vein thrombosis, okay, renoid disease, cardiac pathology, okay. So in this question, this bluish discoloration, if I am only, describing this finding, this bluish discoloration is what? And, the answer is cyanosis. The answer is cyanosis. If only I am talking about the bluish discoloration of the toes. Okay. So, because, other findings, over here, I'm not seeing that there is swelling or asymmetrical edema, or there is tenderness of the calf muscle upon examination. I don't see any of this information over here. So cyanosis, what is the description of cyanosis, which is the correct answer, is a bluish discoloration of the skin or mucous membranes caused by decreased oxygenation or reduced peripheral circulation. I understand that the patient already have peripheral vascular disease and they have other cardiovascular comorbidities, but in this question they are asking you what is this bluish discoloration. So this bluish discoloration means that there is less oxygen going to the periphery or peripheral tissues, might indicate that we have a peripheral vascular compromise, arterial insufficiency, hypoxemia, which is low oxygen content in arterial blood, reduced perfusion. This means that there is less blood going to the periphery or supplying the tissues. So in this case, bluish toes, cold temperature, delayed capillary refill. This is classic for peripheral cyanosis. This is a classic description for peripheral cyanosis. Okay, let's look at the incorrect options. Deep vein thrombosis. Deep vein thrombosis, typically, they will describe a different scenario in this question. Calf pain, and sometimes we call this positive Homan sign. Swelling, and this swelling will be distally around the ankle and foot and will be asymmetrical. I mean, it will be on the right side and you will not see the same on the left side because DVT is rarely bilateral. Okay, it is usually unilateral. Warmth. So when I am touching the skin, it will not be cool, it will be warm. Redness. I will see erythema. Increased girth. If you do round measurement, I will see increased girth, and this is due to the edema situation or asymmetrical situation. And increased girth, I am comparing what? I'm comparing the right side against the left side here. So DVT will not cause bluish discoloration of, with cold temperature, delayed capillary refill. These are mainly suggesting arterial insufficiency, and DVT is a venous clot, is something in the veins, not in arteries. Raynaud disease. Raynaud disease is episodic when somebody is exposed to cold weather or to stress. Their peripheral circulation is affected. There will be mainly the fingers will be affected. The fingers will be turning from white to blue to red color changes, which are associated with this disease. Usually it is acute. I told you in response to exposure to trigger like cold or stress, or might be post-operative and will be localized to the operative limb. Okay, so and the findings in this question is not consistent with Raynaud's disease. How about cardiac pathology? Yes, we know that cardiac pathology might cause cyanosis, but it might be of a different type. It will be central cyanosis, will be affecting mainly the lips and tongue, and will it is not isolated unilateral to discoloration, post-operative stuff like that. This is mainly a compromised, localized and vascular is not something related to the heart or something like that. Yes, so we say the cardiovascular system, and so here this is the vessels which are affected, but not the heart itself. Okay. So if we need to summarize, if you find a description of red, warm, swollen cuff, most probably this will be DVT. If you find pale, cool, pulseless, if I am checking the distal pulsation in posterior tibial artery or dorsalis pedis artery, you will find a pulseless or reduced pulsation, weak pulse, and this is usually arterial occlusion. Bluish extremity, which is cyanosis, like in this question, peripheral cyanosis. White, blue, red, episodic, I mean all of a sudden appears, acute. This is Raynaud's. Okay, this was our content for today. If you would like to join my BT license exam preparation course, or drop me a message on this WhatsApp number 001-442-248-7206 or 0020-102-774-3702. If you are if you graduated from a physical therapy program and you are planning to join a post-professional or transitional DBT program, we can help you to join the program at DBT program at University of Montana at a discounted rate. So again, drop me a message on WhatsApp number 0014422487206 or 00201027743702, and I will send you the details as soon as I can. Thank you so much for watching my content. Please share with your friends and subscribe to the channel will be much appreciated. Thank you.